today we have a topic which is really an important topic, patient advocacy. And the guest speaker is Aileen Gerhardt, who will be talking about what patient advocacy is and how patients can benefit from having a patient advocate in their life. Right now, what's going on in healthcare is this perfect storm where people are living longer. And because people are living longer, most of them have chronic conditions that can and may get worse and worse over time. And there's so many, as we all know, changes in the medical system, new medications, new way of doing things. It can get really, really overwhelming. And so for a person to be able to present themselves in a hospital setting, already overwhelmed and maybe in shock about what their new diagnosis is, for them to deal with what they're going through personally, and then to be able to understand and remember all the complexities that's going to be shared with them by different specialists, it can get really, really overwhelming. And that's why patient advocates can really make such a big difference in the person's health outcome. So, Aileen, can you tell us a little bit more about a patient advocate and be able to really shed some light on how people like yourself, how they could really be integral in the healthcare outcome of patients out there?
Sure. I actually have slides prepared. I'm going to go ahead and share. And if you have questions along the way, feel free to jump in and ask those as well. Thank you for the opportunity to share this topic and to partner with the various partners for this program. It's really appreciated and well needed, and I hope our audience learns a lot.
Thank you so much for being a part of this.
Appreciate it. So when we talk about patient advocacy, the first thing I want to do is just give a sense of, as Debbie noted, the changes in the healthcare model, right? So what we know is that being a patient is hard, and supporting a patient is hard, as Debbie just referenced, when we're going through those things either directly as a patient or as someone supporting a patient, a family member, a friend, etc. We're often emotionally exhausted and using all of our energy to focus on either healing as a patient or focusing on getting the best possible information to support our friend or family member. And so because of that, it's really important to have a sense of how the healthcare system works. And so in the past, as Debbie noted, the healthcare system was really one directional. We sought out medical providers for information, and the medical providers told us what needed to be done, and we as a patient followed through on that. But the reality is, as this illustration shows, is that we really are one of two experts in the room when we're attending a medical appointment. So one is certainly the provider who has had all kinds of training and knows a tremendous amount about medical situations, but we're an expert about us. We live with ourselves 24 hours a day. And so we are the person who knows the most about us. So if you go into an appointment thinking that way, it's often helpful to see it as a team approach. So unfortunately, even though there's so much talk about patient-centered care, sometimes people can feel that the patient-centered care looks like this. It's nothing that's done intentionally. It's kind of the way the system is working so that information can be documented with a focus on the patient, but physically, our provider may have their eyes on the computer and not making eye contact with us. Or in this illustration, they're back to us, but still listening to what we say. So it's important to have a sense of how to navigate that and who can be some good resources to make that as easy as possible. So as we've discussed, people are having harder and harder times navigating the healthcare system. It's complicated. It changes. There are all different things to keep up with, rules. And so it's really important to have a sense of what are some resources available to me. When we say patient advocate, what do we mean? When we talk about an independent patient advocate, what might that be? Who might need an advocate? Some reasons people are hiring advocates, independent advocates specifically, and the benefits of having an advocate, either independent or in general, on your team. So we're going to explore those this morning.
Aileen, I like how...
so it's also really important.
Oh, sorry. I was just going to say that, I like how you are about to share what a patient advocate is, because I want to point out that hospitals have patient advocates, and I'm not sure if too many patients know that. And if they do end up finding out that they are patient advocates in the hospital, sometimes it's because of a negative incident that they have a patient advocate. So it's, very important to bring awareness to the fact that all hospitals do have patient advocates, and they work for the hospital.
Right. That's an excellent point. So one of the things that's the biggest challenge in navigating healthcare is that we're all not speaking the same language, right? There's so much jargon and different phrases when it comes to navigating healthcare. So in order to talk about patient advocacy, I thought we would start off with a basic framework so that we're all on the same page going forward. So an advocate, as it says here, is someone that addresses complex healthcare problems that a consumer may face. And even though we are a patient, it's also important to remember at the same time, we're also a healthcare consumer. So it's important to access resources in a location where you are, such as a medical provider's office, a hospital, a care facility, or independently that can help you get the guidance, information, and solutions you need, as Debbie mentioned, to really make sure you can have the best outcome possible. We can't change the medical pieces, but we can change how we prepare to navigate those pieces. So as Debbie alluded to, there are a number of different types of patient advocates. And patient advocates also call themselves healthcare advocates. And some folks identify themselves as patient navigators. And so there are different terms for a general sense of how people are helping people navigate the healthcare system. The folks in the various places, such as medical practices, hospitals, and other providing facilities, are excellent resources in the time that you need those resources. And it's definitely important to seek those out. Hopefully, not only if people are concerned about something they feel is not going the way they want it to, but just in general to reinforce their support navigating the process. There are a couple of things to keep in mind. Because the folks who work in the practices and facilities are employed by an entity that gets reimbursed from insurance, there isn't the same independence as one might find with an independent patient advocate. That may sometimes not be an issue, and sometimes it may just mean that it also might help to bring aboard an independent patient advocate to work in partnership with the hospital or medical provider staff, seeing everybody as part of the team. But it's just something to keep in mind as well, because unfortunately, sometimes facility hospital advocates are constrained by what the insurer will and won't allow to be prescribed or ordered, et cetera. And that's not in the best interest of the outcome for the patient, which again is not the professional's fault at all. It's really, unfortunately, a product of the system. So more and more people are becoming board certified patient advocates, and the credential is summarized as BCPA. So those folks are folks who work in medical facilities, hospitals, care facilities, medical practices, and also independent board certified patient advocates. The idea is that there's a credential, there's a set of competencies and ethics that as a healthcare consumer, we can expect as part of our work with a patient advocate, no matter where they are employed or how they are employed. So if you see BCPA after someone's name, that's what it would indicate. And if you want more information about the credential, the Patient Advocate Certification Board has all kinds of information on their website, which is listed on this screen as well. As for me, I participated in the first exam offered in March of 2018, found out in April of 2018 that I had passed. Phew. And then had the opportunity to recertify this past December. And so my certification for 3 years is good as well. So that involves hours of continuing continuing education credits, et cetera, as you would find in any other discipline. So just some information about independent board certified patient advocates. It's a long title, but it's really important to know what's involved. So as I discussed, being a patient or supporting one is extremely draining and challenging. And no matter what our skills are, the most organized person, the most methodical person, when we're thrust into the stress of navigating someone's health, all of those skills can go out the window. And so it's really important, whether it's a friend, a family member, and or a professional, to be involved in offering additional support. And so independent board certified patient advocates have been trained to navigate the complexities of today's healthcare system. People come to independent patient advocacy from all kinds of backgrounds. People come from medical backgrounds, such as being a nurse, being a physician, having insurance backgrounds, and often having some kind of personal experience that launched them into wanting to help others navigate the healthcare system, either that personal experience as experienced individually or supporting a friend or family member. The piece about who the advocate is employed by is important in terms of the ability to appeal or push back as much as possible. And so that's what the only allegiance to the client is, that by working directly with a client, for example, I am only employed by that client. So I do not have to navigate the complexities of my employer in terms of what might be covered and what might not be.
That's a very, Eileen, that's a very good point. So I could see how an advocate that works for a hospital will be there for the patient, but in terms of the amount of patients they need to cover and also their ability to continue taking care of or supporting that person after the person leaves the hospital system,
right,
have to terminate, right? Because they're only there in terms of
right.
what they could do for the person, the patient in the hospital system, right?
Of course, continuity is key, right? And so all those folks working in those facilities want to be able to follow those patients home, right? In an ideal world, we'd be able to provide that follow-up. But the system doesn't allow us. So your point about continuity is so important. And so working individually with an independent advocate gives you the opportunity to have that continuity no matter what setting you are navigating for care. It's an excellent point. Thanks for that, Debbie.
Sure.
So when we talk about who might be looking for an independent patient advocate, right? So that with that concept of continuity in mind, I often get phone calls from people who have a new diagnosis or are living with a chronic medical condition, are trying to coordinate their care team. They have more than one doctor or healthcare clinician. They feel there's a misdiagnosis. They are wanting more information and they're looking for someone to talk to about it and assist. So that's one piece of it. Also, when people receive medical bills and they are overwhelming, hard to understand, medical bills come with all kinds of numbers on them besides just what we owe as a patient. And often, unfortunately, many times medical bills are incorrect. So it's always important to speak with someone to make sure that you can verify that the billing is correct. People often contact advocates about that. Understanding healthcare insurance, wanting to know what clinical trials are available, and also seeking a second opinion or even a third opinion, and finding the right provider to be able to do that. Someone who might identify as a solo ager. So when we refer to solo agers, they're an adult 55 plus who is living without the support of adult children or adult family members, and need additional support in their general support system. Often I hear from people who are trying to assist their aging parents or aging relatives long distance, which is extremely difficult to do. And so having someone on the ground located locally can be of great help as well. And as well as people who are local and just want good resources to make local decisions. So I referred to language, right? So the notion that we wanted to make sure everyone had a general sense of what we mean when we refer to patient advocate. But sometimes when we're speaking to clinicians or anyone in the healthcare system, they start using language we don't understand, often referred to as medical jargon or some kind of jargon, right? So I found these two illustrations just to give us a sense of just how challenging it is. So these two guys are walking along saying they need to invent more words we don't understand because people are starting to clue in. And this poor gentleman in the other cartoon was asked for a stool sample, and he brought in a literal stool, right? And so if we're not able to understand universally what is being asked of us, it is very difficult to adhere to medication, to follow up on treatment, all of those different pieces. And so it's just important to additionally have someone on your support team who can help you navigate those pieces. So here is a list of 21 reasons why people hire patient advocates, and they're all different reasons for all different times, right? Support during a crisis, help in general navigating the system, help asking effective questions, being able to assess what might be right for that individual, helping them prioritize, identify values, and make sure those are honored as part of their healthcare treatment, which if that's not something you consider, is something that's really important to consider. How something affects your quality of life. Are you able to drive? Are you not? Is it going to change your ability to listen to music or some other part of your everyday life that you want to make sure remains even while going through any kind of treatment? And it's important to know what your options are to see what reflects your interests the best. Someone who can be that connection, that bridge, to serve as a face of the patient's support system, especially if the support system is predominantly long distance. If folks are all over the place and are not geographically in the same place as the patient, it's really great to have someone in person and located locally. It's, of course, very important for people to be able to have the support they need to focus all of their energy on their health and treatment. As we discussed, being a patient is hard work. And so having that additional taking notes and listening carefully and all of that when we're not feeling well is almost impossible. And it's really important to have additional support. Debbie's point about continuity for transitions, extremely important. And one of the main reasons people reach out to independent patient advocates. Some other reasons, people are trying to secure a second opinion. And like I said, you're even most often with insurance able to secure a third opinion if it's warranted, not just general shopping, but for a situation where you really want to have the most information possible, you are able to secure a second or third opinion, and people will work with a professional to make that happen. I work with people all the time in preparing for a doctor's appointment, prioritizing questions, making sure one sets an agenda so that they're able to make sure their questions and symptoms are addressed in the period of time in which they have their appointment, medical appointment of any kind, helping a patient understand their rights as a patient, and of course, responsibilities as a patient as well. And then things involving advanced care planning, end of life planning, as well as medical billing and insurance claims, denials or appeals. So for independent patient advocates, the goal, and in general for all advocates, and advocates, whether they have titles of advocates or not, your nurse, your doctor, any clinician is an advocate in terms of wanting the best for their patient. There's no question about that. As we've discussed, folks who work independently have the space to follow a case all the way through navigating all of those different clinicians. And so when we think about an advocate's goal, and again, that's anyone's, right? It's to provide the client with the support and education they need for the individual to make their own informed decision. I always talk about when I discuss what I do for a living, because independent board certified patient advocate really doesn't describe it. I often tell people I don't make widgets, my product is information. And so the idea is to work with a client so they have all of the information they need to make an informed decision that is right for them. So what does that look like? Helping coordinate someone's care. It might look like sitting by the bedside with concerns of patient safety, or interfacing with various clinicians as they come for rounds, or physical, occupational, respiratory, or some other kind of therapy. Helping people understand difficult medical information and terminology, and then also reviewing medical bills to find errors or duplications. that can happen more frequently than we'd like. Again, it's not something that's intentional, but unfortunately, billing involves simply typing digits into a keyboard. And we know just in how we navigate the world technology-wise today, how many different ways we spell words wrong, we missend a text, all of those different pieces. You can certainly imagine how that could unfortunately happen in the process of putting codes in for billing. So it's important to review those and make sure they're accurate.
Aileen, before you move on to this slide, can you just go back to the one you were just on?
Mm-hmm. Absolutely.
Yes, this one. So just really emphasizing the fact that patient advocates, when you're working with your clients, you're not making the decisions for them.
Nope.
That's so important. It's you providing digestible, practical information that they can understand in their own way of understanding it so that they make the decisions, right? So.
Right. And if there's something they don't understand, I will keep finding different ways for that digestible information to be delivered, researched, etc., so that people feel they do have the information they need to make that informed decision. An advocate is somebody who amplifies the voice of their client, but as you very clearly pointed out, is not a decision maker, is someone that helps people access information to make the best decision for themselves. It's an excellent point. Thanks for going back to that.
Yeah, and it's just it just reminds me of health literacy and how there are because of so many different things changing in the healthcare system. A lot of different research out there on better health and well-being. It can be confusing for people to know what's the current information. And so having health literacy and being able to kind of educate yourself or staying in the current about medical information is very important. And with that, being more comfortable when you're talking with your nurses or doctors about what's going on with your health. And when they are talking about your health condition, you're more likely, hopefully, to be more comfortable to advocate for yourself. Because that's the first advocate in the team, right? Is the patient themselves.
Absolutely.
Right.
And so programs like this and other programs give people the education they need, even if it's a review and information they knew, right? It's always good to hear information again or the current information. But always to make sure that people are as educated as possible to be able to feel that comfort in navigating what is a very complex system. And then having a sense of when one might need additional support on their support team, reaching out to the patient advocate in a facility, at a hospital, in a medical provider, at an insurance company. Or if you also need that independent support as well for continuity, for other reasons, knowing when you might need that and knowing that it's available, which is another great opportunity of participating today that I'm very grateful for, is just letting people know that they have all different resources to be able to access both within the healthcare system and outside of it.
Yeah, thank you.
Sure. So the pieces around independent patient healthcare advocacy are obvious, but just to give a sense of what the benefit is, right? It leaves space for someone to put all of their efforts towards healing. It also really gives people a peace of mind that a professional is involved and in handling the important details. Again, that is not decision making, as Debbie pointed out, and is so important. That's about accessing information so that at a time of stress, whether that's stress about a medical bill, stress about a current situation, health-wise, or something else, that you then have someone who's able to help you get the important details to make that informed decision. When it comes to an independent healthcare advocate, that's certainly someone who, based on the way the system is set up, does not have that conflict of interest in being employed by the system. But as we've discussed, that's not the only way to access and benefit from an advocate and advocacy support. It's just one way to do that. So when we think about healthcare, and both Debbie and I have referred to it, right, as part of a healthcare team, right? If you see yourself in the center as that expert, that woman was sitting in a medical gown at the very beginning, right? Telling her physician, hey, I'm an expert on me, you're an expert on the medical stuff, right? You're in the center, that patient-centered care. And then all of the other people involved in your care are part of a team. Ideally, we'd like them to be communicating with each other, but it's really important that if they're not, you are. And if you are not able to do that, that you seek out the assistance of someone who can help you do that as well. Advocates help clarify goals of care and clarify expectations. They really make sure that people understand and follow the instructions either from an individual medical appointment or a hospital discharge or another facility discharge. And the healthcare system professionals really appreciate that because it means that, again, we're working towards the best possible outcome for the patient and their support system. Healthcare advocates can also help people work with a provider to set up payments. If you're overwhelmed by medical bills, sometimes our easiest way, human-wise, to cope with that is to put that on the side and just not deal with it, especially if we're dealing with the stress of navigating an illness or some other medical situation, and especially if we're also supporting someone who might be going through that. We talked about how important it is for communication to be clear and people understand what's being discussed with them, because without that, it is very hard to follow the directions. And that again affects someone's health and health outcome. Physicians and clinicians also appreciate that working with an advocate saves time for the clinician. When someone has a better sense of the instructions for why they're taking a new medication, or why they need to go for blood work or another test, or some other change in their care, and they truly understand that, there isn't necessarily, there's better compliance, better follow through with exactly what to do, and fewer phone calls and notes in the portal, if the portal is being used, or the gateway, or whatever the system is, to communicate with that medical provider's office with questions. So having our clients and patients know the information and feel comfortable with it, as Debbie suggested earlier, is really important, and it is a great help to our clinicians as well. Advocates certainly help with patient education and work very hard, as everyone does in the healthcare system, to prevent medical errors. And it's really important, again, to think about it as a team and work in collaboration with the medical providers as just another member of the team who's able to offer their support and expertise in navigating the system. People ask me all the time, where are different places you can find patient advocates and ways you can access them. There's a national organization, the Patient Advocate Foundation, that offers free case management services. They also have some funding to help people with certain medical conditions that's listed on their website. As we discussed, hospitals, senior living facilities, people's health plans, health insurers may now offer people a patient advocate or refer to that person as a case manager, or the availability of a social worker or an RN, a registered nurse, is also an option and certainly helpful in your support team. There are some employers that are now offering patient advocacy services as part of a benefits package for their employees. By having employees supported for the employer, there's less time missing work and there's more quality done of their work because they're not missing work in the same way. And so having that additional support is certainly a benefit to the employee and also to the employer. Locally or nationally, in terms of accessing an independent patient advocate, we have a regional group. It's actually really made up of New England advocates. We haven't changed our name yet. Massachusetts Healthcare Advocates. We have a website with a directory. You can read about all the different advocates. Our independent advocates across the country all specialize in different things. And there are some who only work on insurance and medical billing. There are folks who work specifically with a type of condition or work with oncology patients. There are people who only work on complex medical cases. And there are people who help people in general. So it's important to read over folks' bios and profiles. They'll tell you in their business listing, what they offer. That's on a New England level. If you're looking nationally, there are two very useful resources. The National Association of Healthcare Advocacy, abbreviated as NAC, has a directory on its under construction website. It's getting retooled. And Advo Connection is another great resource for that, where you're able to read about what different services are provided by independent advocates and be able to link to them as well. So those are three resources I recommend, because it's extremely important, as with anything else, that we do research to find the person who is the best fit for us, right? And we certainly do that with any other professional we might be working with. So I just thought, right, so here this physician, this clinician has gone to medical school and has finally come across a condition that they don't know how to treat. And that condition is called good health. So hopefully we all experience that at one point or another. And I look forward to further discussion with Debbie regarding advocacy.
Wow, you've covered so much, Aileen. I love it. Great information. So people can reach you at, what's the best way for people to reach you? The best way for people to reach me, I'll actually put that back up on the screen. The best way for people to reach me is either the information at the bottom of the slides, the phone number 617-651-2140, or the website, which is beaconpatientsolutions.com. You can actually book a 15-minute complimentary patient advocacy consultation, just to have a sense of what people are thinking about and what they might need, and see if working together is something that would be a good fit for you. I also offer a newsletter I send out monthly. It's complimentary, and it just has basic information about what's happening in healthcare, et cetera. Thanks for asking about that. Sure. So I have some questions.
Sure.
let's start with your training. It seems that a patient advocate needs to know a lot about everything. You need to know about insurance. You need to know about medical jargons. You need to know about health and healing, end of life planning. I mean, I can certainly see how private pay patient advocates can really niche themselves so they could really be the expert in that field. But for people who might want to serve a greater group. So can you just share with us, what does the training entails and how can you know so much about so many things?
So training looks like different things for different people. Because I had a background in sociology and not a formal medical background, I made the decision to enroll in a certificate program for consumer health advocacy through the University of Wisconsin-Madison, through their Center for Patient Partnerships. And the program was 15 months long, and I actually had the opportunity to do it remotely, which was very helpful. But one wonderful aspect of that program is that they actually run a free patient advocacy clinic. And so nationwide, there are certain parameters for being able to be a client, but it's a teaching clinic. And so as part of my training, not only was I taking courses in the current state of the healthcare system and different models for advocacy, but I also had a supervisor and was assigned cases and worked with clients navigating the healthcare system. So not only was I learning about it in a classroom setting, but I was also fully supervisor supported, of course, but working with a client on their particular situation and connecting them with the resources they might need for any kind of advocacy or challenging a medical bill or filing an appeal or having coverage for something that Medicare didn't cover, for example. And so all of those pieces gave me the opportunity to integrate those two experiences together to understand the healthcare system, both dynamically and what we discuss in a classroom setting as well. Other folks come with training from other academic programs. There are some academic programs, about 6 or 7 all over the country. There's one here in Massachusetts at Assumption College in Worcester. And there are some in California. There's one in Florida. There are a couple in New York, et cetera. And so people can go that route. There are other people who come with medical training from their nursing degree, their pharmacy degree, their medical degree, and they bring that piece of the healthcare system with them as well. When people are approaching, preparing to take the credentialing exam, then everyone is bringing all of that knowledge to being able to answer those questions uniformly so that the healthcare consumer, no matter what the background is for a patient advocate, what the educational background, what the previous professional background is, a healthcare consumer can expect that same level of adhering to ethics and having the competencies and knowledge of quote unquote knowing everything. And the best thing about when you don't know something is knowing the right place to look to help someone get the information they need. And we're also fortunate as an industry that we also partner with each other to share information. That's one of the great benefits, certainly, of our regional group. We refer to each other all the time. We ask each other questions. We meet monthly. It gives us an opportunity to take what we know and learn from and with each other. And that can only benefit the patient and the consumer.
Thank you. I remember in nursing school, one of the core themes that our teachers instilled in us is patient education. You need to teach the patient needs to know. And you need to speak up for the patients, especially when the patients are not able to speak up for themselves.
Mm-hmm.
And I could see how a patient advocate can really benefit a patient who, again, is overwhelmed, may not have the support system in their lives, may have limited educational background to be able to navigate and understand the system. And I can also see how the medical providers, the clinicians, can really benefit from a patient if and when they have a patient advocate, an independent one, because then they know that the patient is in good hands and whatever was shared is going to be further reinforced. And they know that the patient is going to have better outcomes than a patient who may leave them looking kind of confused and dazed.
Right. And for patients who, if the language that the medical provider or clinician is speaking is not their native language, an advocate can help someone arrange for an interpreter to make sure, again, that how important it is that we understand what's being told to us, right? And so another resource on that supports team is asking for an interpreter if that's something that would benefit you, because as you just pointed out, any clinician, any provider wants their patient to have the best possible outcome possible. And in order to do that, we have to understand what the conversation is all about. And so, I always tell people, if you need an interpreter, ask for one. Don't ask for one 5 minutes before your appointment. That doesn't usually work that way. But arrange it ahead of time or work with someone to arrange it ahead of time. Make sure you bring the pieces with you that will help you have the best possible outcome at your appointment. This isn't a time to leave your reading glasses at home. It's a time to bring them with you, right? It's a time to make sure if you need hearing assistance for any reason, that you bring those with you. Or if you have low vision, that you have a tool for that as well, that your clinician wants you to be as prepared as possible. There isn't anything they haven't heard before, right? You went through all that nursing, right, school. There isn't anything anyone could tell you that you'd be like, oh, I've never heard that before, right? And so it's really important that we're honest with our clinicians. And if we're working with professionals in our support team, it's equally as important to be honest with those folks as well. And support is really critical for us being able to navigate an extremely difficult system.
Yep. And, so I love telling my patients, always ask. Ask. If you don't understand something, ask them to rephrase it or, share it with you, in different terms so that you will understand exactly what is going on in betterment of you, your whole health plan. So sometimes people forget that they have the right to ask, or they just are not aware of their patients' rights. And really, it's so important to tell and share to patients that they are the most important part of that healthcare team.
Absolutely. And the most important question we can ask as a patient is 3 letters, and it starts with a W, ends in a Y, and has the middle letter of H, right? Why? Why am I being sent for? Why are you suggesting blood work? Why are you suggesting I take this pink pill? Why, right? Like why helps us fill in with the what, right? So the what is, this is what's happening right now. This is what you might need. In order to find out more information, I'm sending you for X. If we don't know why we're going for that test or blood work, one thing that drives me crazy is when patients get a phone call that says the blood work is good, click, right? Well, wait a minute. You just sent me for that blood work to find something out. What does that mean? Why did you send me, right? So again, referring to what some people refer to as agency, right? That ability of ourselves individually to be able to know that we have the right to ask those questions. Our clinician is not going to take it personally, and they certainly shouldn't, but they're not going to. And we have every right to understand the information we need to make the best possible decision for ourselves. And if we're helping out a friend or a family member, to make sure we also understand that information so that when we talk about it with that individual, we make sure to do that as well. If there's something that is shared in a clinician's appointment and people want to make sure they get it absolutely right and they don't have a benefit of an additional person with them, I often recommend that they ask the clinician if they can record the instructions or the information, either on a micro cassette recorder, if that's something someone has, or if they're comfortable doing so with a mobile device they have with them. Because then in the comfort of your living room, you can hear that information in a different way than in a 20-minute appointment where you're trying to make sure you get through all that information. So that's another tip as well.
Very, very good point. I was just doing an Aging Strong in-person program at the community, at the Quincy Council of Aging at the Kennedy Center yesterday. And one of the topics was being your own self-advocate. Mm-hmm. And to, if possible, have a family member or a friend come with you when you have your appointments, because sometimes you could be focusing or thinking of something and you get stuck in that thinking loop, and then you miss a part or most of what the clinician or the doctor has just shared with you. And I also shared that if that family member or friend can't make it, to maybe have that person call in or use a speakerphone. So that way you have extra ears, may not be in that room physically, but somebody can listen in and be able to ask questions for you. So those are very helpful suggestions and also extremely important. The other thing someone else in the room can do is help prompt you on questions you wanted to make sure you asked, right? Again, with that focus on, I really want to ask about my knee. I really want to ask about my knee. And yet I have 3 other questions on my prep list, and I might not get to them. And so the other person isn't, as with anything else, is simply support, isn't the focus of the appointment, right? The patient is, but can help prompt that patient for, you mentioned you wanted to ask about this. Oh, right, I wanted to, right? So as you pointed out, in person, on the phone, by video chat, whatever works, even if it's a telehealth appointment, you can also ask permission for someone else to attend that appointment by accessing that link as well. That's something else you can do if folks are still navigating telehealth. But in general, having someone else there, whatever there means, right? In person, on the phone, by video chat is extremely critical and an outstanding suggestion for patients navigating the system. So Aileen, we're almost at the top of the hour. Can you give us one takeaway based on what you shared with us today? You shared a lot of wonderful and valuable information. Give us one tip. It is extremely important to have someone else helping you navigate the healthcare system. Again, an advocate in the most general sense. And so it's really important to figure out who can be that for you. If that's a friend, if it's a family member, fantastic. And if it's a professional, seek out resources to make that person a part of your team as well. Great. And I'm grateful for the opportunity to have the conversation, which I'm extremely passionate about. Oh, I could tell. It's just really an important topic, and people really need to know that patient advocates are there in the system, the healthcare system, in the insurance company, and also in the private sector. So very important to know that somebody is there for you. So I want to thank everybody for joining us today. I really want to thank the Quincy Health Department for this support, this sponsorship, to be able to do the outreach work in such a way that's is very accessible to many people out there. So thank you, and I want to thank everybody who joined us today.